sharing. Come on. Okay, so question on your, well, just do what you want, computer. Cool. All right, so question 117 on yours. Identify the rhythm that you're going to be presented with. Make sure you know your blocks. Okay, I'm gonna just throw that out there. Okay, vagus
So when you,
nerve. Go ahead.
I'm sorry, when you say no, the blocks, are you talking about bundle branches as well?
No, just first
Yeah,
degrees, second degrees, and third degree. Make sure you have those down.
okay.
Okay, and what like your cutoff kind of is for like what's the difference between a sinus rhythm and a sinus rhythm with a first degree block. Chest pain, decreased level of consciousness could indicate interruption of blood flow. Yeah. Good. 120 is good. Emphasis on that. Okay, know each range for the dopamine question. So, like, it's 2 to 5, 5 to 10, and 10 plus. So just know which one is what which. Where, like 2 to 5 is beta, 5 to 10 might be dopaminergic, and then alpha. So just make sure you specify your ranges there for that one. Syncope doesn't necessarily cause pulmonary edema. I'm gonna it's on the, hold on. I can't type. So like on the list of problems that would cause pulmonary edema, syncope is low. Okay, so like if you have a patient who syncopizes, that wouldn't necessarily be your first thought, like, oh, they passed out because, or they have pulmonary edema, that's why they passed out. It would be more like, that's not the correlation, I guess, is what I'm trying to say. There are other things that would be more correct, that create pulmonary edema, like aspiration or smoke inhalation, high altitude sickness, stuff like that. So just keep that in mind. Boop, 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 left. There's a little emphasis. On that. Also so if you have a patient whose left ventricle isn't pumping effectively, where does that back up to?
The lungs.
The lungs, which would mean that you would have increased pressure, perhaps. Again, back pressure, right? We just talked about that. Just always remember that if you have like a problem with one side, it's going to go back from where it came. Emphasis. That's the worst color. That's not even a thing. Good. Emphasis. The highlighters really just piss me off right now. It doesn't want to play nice. Pharmacological management for pulmonary edema. Hi, puppy. Cardiogenic shock. Good. Perfect. Appropriate acid base. Yes, ventilations. That's perfect. First line for VFib is defib. VFib is defib. Good. Make a faces at me. 133, spot on. 134, spot on. Excuse me. What is your first line med for bradycardia? The question asks the first line medication for bradycardia and asystole. Just remember that's dinosaurs with EMS problem. This medication is not used in asystole anymore.
Their original song they played, it sounded good. The other song they played, which song after that?
Not used in asystole
But I mean, they're playing
anymore.
in the living room.
When did COVID start?
Where else?
April 28, 2020.
First line for SVT. Yep, that's right. I think I gave you that one. In 36, I gave you that one because it's all weird. Epinephrine is not wrong either. Right, actually that is right. Just kidding. Read the wrong question. Ignore me. Narcotic analgesic. Emphasis. Digitalis. Good. So if you have a patient who has a problem with tachycardic dysrhythmias, are they going to be getting digitalis? Okay, 140 spot on. Emphasis on that one. Perfect. PR interval, perfect. QRS interval, perfect. I'm gonna edit this one just a smidgen because it's old again, old school problems. It's not by much, but just for clarity's sake. Okay, good. That one I know I gave you. Hold on, I've lost my spot in the flipping of papers. Okay, I found my spot. 146 is spot on. 145, good. I'm just going to add a keyword for you. 147, spot on. I'm just going to add a little emphasis on this. That's correct. Glycosuria is correct. I'm just going to add what it's actually on the test. Okay, good. What is one of the complications of DKA in regards to, that's not a word, cells using glucose? Just add that to your, just quickly define that one. Okay. Good. Emergency intervention, unconscious. Emphasis. Danny was on the truck with me. We actually got to give a guy D50. And then I got to explain to him how we don't usually transport diabetics after we wake them up because they don't want to go because like now they're better and they don't really need to. And it's like the easiest RMA you'll get in the city because like the doctor's like, so we got this guy's sugar was 13. We gave him the glucagon. Well, he got a line, and I'm like talking to the guy's daughter. I'm like, "Can you warm up food for him?" She's like, "Yeah, absolutely." So he wakes up. We get him up off the floor. I'm like, "How you feeling? Good? Here, eat this." He had about half the food down. I'm like, "You want to go? I'm assuming you don't want to go to the hospital." He's like, "No." I'm like, "All right, cool." Already on the phone with the telemetry. Diabetics, like the best, the easiest job that you'll do. You go, you wake them up. You say, "You having a good day? You feeling better? Here's some food. What happened? You took your insulin, didn't eat? That's all right. You stay home." Emphasis on this one. 157 spot on. 158 is spot on. 159's good. Emphasis. Okay. Disease transmitted by respiratory secretions. Awesome. I'm going to give you some emphasis. Your most common. Once. Yep. Perfect. Bless you.
Thanks.
Come on, caps locks work. Boo, boo, boo. Okay. Emphasis. Clarification. Good. Peritoneal. Golden. $167 spot on. Gonna change this one. That's like one of those age-related things, right? They're starting to get to that point where you can actually ask a kid what's going on with them. Like, hi, like, what's bothering you today? They're like, my stomach hurts. You're like, okay. 169 spot on because I gave it to you. Emphasis and an edit. Actually, there was a really interesting NYU had a CME with the medical examiner, and they actually talked all about SIDS. It's 2 to 4 months is like the peak, which is like really wild. Like there's like a significant peak too. Like it's a couple kids die, 2 to 4 months. You're like, oh, that's a terrifying time of your life. Seizures. Emphasis. Cool. Come on. Highlight. Good. Um, come on. Computer's not having a day with me right now. Ugh. Gonorrhea. Woo. Everyone's favorite. Okay. Contaminated needles. Never recap. There you go. Good. In there. Perfect. Gastroenteritis. What would... And this actually, the correct answer goes against all of the things that you will always see in regards to taking a multiple choice test, where like there's options that say always and never are not correct. Not true. Just gonna... Don't necessarily agree with this. I agree with what you guys have. I think that's more correct of an answer. But I'm going to make sure that you don't choose the wrong answer that is the correct answer, if that makes sense. Emphasis. .178's on point. Good, good, good. Oh, that's fantastic. Emphasis. Good. Indicator of fetal distress is... I'm just gonna... Again, I don't disagree with the information that you're sharing. We don't have things like fetal heart rate monitor, and if you do, like in regards to the NRP and stuff, if it's like, you know, when you do your APGAR scores and all of those other things, you're hoping and you're assuming that the child is going to be breathing. And you know, when they're blue and they have no respiratory drive and they don't have a strong cry, right? Like that's like a quiet child is a scary child. Kind of, I guess, go with that mentality when it comes to that individual answer. Good. Okay. Just remember the elderly also have very high rates of depression. Emphasis. Other issues are organic brain syndrome and other chronic illnesses that can cause psychiatric issues. Good. Move bystanders. Okay. emphasis on this. That's kind of like, right, that's your key. So if you have a patient who took too much diazepam, they're going to be too relaxed, they're not going to be breathing enough. So if they're not breathing, they're going to be acidotic, which is perfect. And then, which would mean that their pH is going to be hot, up or down?
Down.
Down, good. And then that would be respiratory acidosis. Perfect. That's exactly what you need to know for that question. Emphasis. Oh no. Oh no, what happened? Okay, there we go. And that's, I think, it. Yep. All right, cool. I have also come to the end of my exam here. Any other questions, concerns, etc.? We are going to have another SJU sanctioned review Zoom. I don't know what day. I have to look. But you guys should be full and well prepared.
It says on the schedule 1 week before the exam. So the exam's on the 11th. The sanctioned review is on the 4th. But whenever you want to do it, it's fine.
Yeah, we'll do it the 4th. That's fine. That's going to be my last functional day for that week. So, yeah, we'll do it on the 4th. If you have any questions or you think that there's some additional level of clarification for certain things that you need, please let me know. We will not be using the study sheet during that. I'll do stuff like going over like acid base and stuff like that. Maybe we'll do some scenarios instead because I have a feeling we're going to have some eyes in the review session. So just for safety's sake. But yeah, so let me know if you guys have any other questions or concerns or anything else that you would like me to go over. Even if it's like stuff like protocols or something that, you know, we'll do a couple scenarios and stuff like that, and I think that'll probably get you where you need to be for this exam. Please study. Please review your review sheet because I think that that's going to get you pretty far. And that's it. Good luck on your rotations and stuff and all that jazz.
Nicole, thank you very much again.
You're welcome. Anytime, guys.
Have a wonderful holiday.
Yep, you too, guys. Have a good Merry Christmas.
Merry Christmas, everybody.
Merry Christmas. Thank you.
Merry Christmas. Bye.